living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Public health campaigns in 2020 have reminded us that we can keep from getting sick with good hand washing. Additional practices can help us and those we love stay healthy, both in the home and while accessing healthcare, where we can be susceptible to both illness and infection. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Janet Whitmoyer, and today we'll be focused on prevention of infection. Stay tuned. Welcome back to Healthy Living for Life. I'm joined today by Pam Webb, an infection preventionist from Great Falls, Montana. Thanks, Pam, for joining us and talking to us about infection prevention today.
Thank you for inviting me.
Absolutely.
I'm excited to be here.
Sure. Let's start off by talking about infections in general. Can you tell us what they are and typically how they happen?
Well, an infection occurs when bacteria or a virus is somehow able to penetrate into your body, usually through skin or through respiratory contact. And once the virus or bacteria or germ, if you want to call it that, gets into the body, it's dependent upon your immune system as to how, if you're going to have an infection or not. A lot of us have had skin infections. So if you've ever had a pimple or a carbuncle or a boil, you've had an infection. And how that occurred is there was a break in your skin and bacteria, probably most likely Staph aureus or Staph epidermidis, was able to cross that skin barrier under your skin and then attack your body to cause an infection. So if you remember, if you've had a pimple, you get the big bump. And you know, your mother always told you to keep your hands off your face for good reasons and not to pop it. But that's how an infection occurs. It depends on the agent or the germ, how it's transmitted from person to person. And that can easily be through cough. It can be through contact with your hands, or it can be through your mouth. And then it depends on the immune system of the person who received that germ. It depends on their immune system as to whether or not an infection will occur.
Okay. You mentioned the three different types of transmission of the infections, the airborne, contact, and droplet. Can you talk a little bit more about the differences between the three of those?
Yes, certainly. It's really interesting. An infection has to be, or a bacteria or virus has to be passed in a certain way from an infected person to a non-infected person for an infection to occur. So for an example, an airborne transmission means that the infected person has a respiratory illness, has a cough, has a fever. A lot of times we think about tuberculosis. And when the person is coughing or talking or singing and it's spewing, everything's spewing out of the mouth and from the lungs into the air, airborne transmission occurs because those bacteria are so small, they can hang in the air, and then you have to breathe it in for you to become infected. So in this case, if you're in the hospital and you see someone and there's a sign that says airborne transmission, it doesn't tell you what the disease is or what the infection is, but that tells us that we have to wear something special on our face, which is called an N95 respirator. And that filters out 95% of particulate particles in the air to prevent the person taking care of that other person from getting sick. So airborne transmission means the infected person coughs it out and you have to breathe it in for a chance to become infected. There's other variables that come into play. It really depends on the person who's infected, how much bacteria they are coughing out into the air, and it depends on the time and the time that the uninfected person spends with the infected person and what kind of environment was it? Was it outside? Then it's likely that the bacteria could spread, in the air and go away. But if it's in a closed building and in a house where there may not be as good a ventilation and you're spending a lot of time with that person and you're breathing in that bacteria, then you have a chance to become infected.
Okay.
Contact transmission occurs generally through touching something. So somebody who has influenza, for example, and that's a droplet, and I'll explain that in a minute. But if someone's not covering their cough and then you touch where they coughed onto and there's virus or bacteria there, and you rub your mouth, your nose, or your eyes, that's the entry point for, actually you could end up with a respiratory infection, but you didn't get it through cough. You got it through touching something that was contaminated with that bacteria or virus, and then you introduce it into your body through the mucous membranes of your mouth, nose, or eyes. Another contact disease might be something like norovirus. Norovirus is a virus that causes sudden severe onset of diarrhea and vomiting. And how that happens is somebody who is sick with norovirus generally is either vomiting or they've got really bad diarrhea. And perhaps they're going to work, perhaps they're working in a kitchen and they're fixing food. They have contaminated hands and they're fixing the food, and then you eat that contaminated food, and then you can promptly not promptly, but you can become ill with the same symptoms. So that's contact. It's generally through touch, or it enters your body through your mouth. Now, droplet transmission is a respiratory transmission again. And commonly we talk about influenza. If somebody is sick with influenza and the flu, a lot of people think the flu is a gastrointestinal, you have a lot of diarrhea, but true influenza is a respiratory illness. And what happens is the person who's ill with influenza is coughing, and you have to be close enough to that person so that they can hit the mucous membranes of your mouth, your nose, and your eyes. Or, like I just explained, how you touch something and then touch the mucous membranes of on your face. With droplet precautions, we're often thinking about influenza. We're thinking about, I kind of went blank, but influenza. We think that COVID might be droplet transmission, but it could also be airborne transmission. And that's why in the hospital setting, in the healthcare setting, if someone is infected with COVID-19, they want the healthcare providers to wear the N95 respirators if they have them, because remember, those filter out 95% of the particulates. And they want us, and then they want healthcare workers to wear a mask. So it's either the N95 respirator or a surgical mask, because that can help prevent the spread. It can help prevent you from inhaling or not inhaling, because it can help you become so that you don't have that transmission through your mucous membranes.
Okay. Great. I think we need to take a break right now, but when we come back, Pam will be talking about healthcare tips on keeping us infection-free in our homes. Stay tuned. Welcome back. We're still talking with Pam Webb, infection preventionist. And now, Pam, I'd like to talk a little bit about in the home setting, some things that we can do. When it comes to cleaning our home versus disinfecting, can you talk to us a little bit about the differences there?
Yes, it's really important. You have to clean before you can disinfect. So it's important if you're cleaning a surface that you're removing all the, in the medical term is icky stuff, or dirt or debris. You have to clean that. You have to remove that, and then you use your disinfectant. It's important to follow the manufacturer's recommendations on how to use the disinfectant. There is something called a contact time. So if the contact time is 2 minutes, then that surface has to stay wet for 2 minutes. So what you don't want to do is spray on the disinfectant and then just wipe it right off. You want the disinfectant to stay as long as the directions, and then you can wipe it off. But you have to clean it first.
Okay, good point. So how often should we be disinfecting, and what things in our home should we really be focusing on disinfecting?
Well, there's this principle called high touch surface cleaning. So think about the items that you touch a lot in your home: your remote control, the refrigerator handle, the bathroom handle or door handle, the sink and the faucets. Those are the items where you would want to spend more time cleaning and disinfecting. And in particular, if you have someone ill in your home, if you're lucky enough to have more than one bathroom, you can assign one bathroom to be for the sick person and the other bathroom for everybody else. So in that case, you're kind of segregating or isolating, if you want to use that term, the sick person from the people in the home who are well. Hand washing is really important as well. So you want to make sure that you're washing your hands. You can also use alcohol hand sanitizer. It needs to be 70%, at least 70% alcohol. And you want to make sure that it has a lotion or an emollient in it. If you're just using pure alcohol sanitizer, it's going to eat up your hands. You want to make sure that you use sanitizer that has a lotion in it so that it will protect your hands.
Okay, and going a step further with hand washing, is there a particular way we should be washing our hands?
Yes, there is, and I can show you right here. So you start, this is how I teach it in my classes. You start with, you can call it the pray position or the namaste position. So you're rubbing the palms of your hands together, and then you do the, I call it the palm over. So you slide your palm on top, and you want to make sure that you get your in between your fingers, and then you do it the other way. And then you come together, and I call this the steeple position. So you want to get in between your hands. And then this is the hallelujah position, because I always think I look like I'm in the choir and I'm singing. So you're rubbing the backs of your fingers together, and then you're doing it again. And then you get the motorcycle, which is the fun part. Rum, 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 rum. You get your motorcycle, and then I call it a pinch of salt into your palms. So you're getting the tops of your fingers, and rum, 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 or not, that was the motorcycle. This is the pinch of salt, and then you're done. You make sure you rinse with your hands down.
Okay, awesome. And now that takes about 20 seconds to do.
Yeah, if you do it for 20 minutes, you're doing it too long.
Yeah, okay. All right. So I'd also like to talk about vaccinations. What role do they play in infection prevention?
Vaccinations are very important, and they've really been a steadfast in our society in terms of preventing infections that can kill people. So it's really important. For example, the influenza vaccination, that's something healthcare workers are encouraged, and everybody's encouraged to get every year. What is in the vaccination is particles of the virus. It's not a live virus, but the intent of the vaccination is once you shoot it into the muscle in the arm, then your immune system recognizes it and produces antibodies. And how this will help protect you is that you still might get sick with influenza, but you're not going to die from it. You're not going to die from it. You're going to have a less severe infection. But there's been many vaccinations, polio, measles, mumps, and rubella, in which we have been able to stop the spread of those infections, which killed mostly or affected young children. So vaccinations are a very key part in our infection prevention.
Okay. I also want to talk about wearing masks. That has been a big subject of discussion. So can you tell us why mask wearing, like not only for COVID, but for other illnesses is important?
If you think about it, if I was coughing, and if you could see the picture of me coughing and everything that's coming out of my mouth and spewing across surfaces, I've got my table right here, or you're sitting right across from me, I'm just spraying it towards you. What a mask does, it's similar to a tissue. So it is something that can cover the cough or the sneezes as you are doing them. And that will help protect the other person. It also protects the surfaces so that it doesn't get on there, so somebody doesn't come along and touch the contaminated surface. And then we talked about it enters the mucous membranes of your on your face and your mouth, your nose, and your eyes, because that's the way the virus gets in and causes an infection. So it's really important to wear a mask. I know we get weary of it. We don't want to do it, but it really does help. It also helps if you don't have a mask to cough correctly. You want to cover your cough. So you want to cough into your elbow. And the way I teach for little kids is we're an elephant and we cough, 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 and then woo. So if you're an adult and you're out and about and you want to do that, that could be kind of fun too.
Okay. Thanks, Pam. We need to take another break, but we'll be right back with more with Pam, and this time talking about healthcare-associated infections. Stay with us. Welcome back. We're still talking with Pam Webb, and in this section we'll be talking about tips for prevention of healthcare-associated infections. So thanks again, Pam. I want to start off with the commonality of healthcare-associated infections. Is this something that happens a lot?
No, it doesn't happen a lot. There's been a lot of initiatives that hospitals have been participating in to decrease the risk of healthcare-associated infections, such as surgical site infections or catheter-associated urinary tract infections. So it can happen, and you need to be aware of this. And there's information that you can get from sites like APIC, the National Infection Control Organization. So it can happen, but there's been a lot of work across the country and including in our state to decrease the risk for those types of infections.
Okay. You mentioned surgical site infections. I'd like to talk about that a little bit more. What are they and how serious are those types of infections?
Well, surgical site infection occurs at the site or deeper into the wound after surgery. And there's things that the healthcare facility does to assure that that won't happen. They will make sure that the instruments that are used during surgery are cleaned and sterilized properly. They've got airflow, environmental safety guards in the operating room. You have trained staff. So there's a lot that they monitor your blood sugar. They make sure your oxygen levels are good. So there's a lot that we do to prevent surgical site infections. There's also things that patients can do to help decrease the risk of infection. If you have an infection before surgery, please don't have surgery because that increases your risk. You need to quit smoking. If you could lose weight, that could be helpful. But I would say talk to your healthcare provider and to your hospital, and they will tell you the things that the hospital does and that the physician surgeon does and that you can do to help prevent the infection from occurring.
Okay, another type of infection that you mentioned was urinary tract infections. I want to talk about that in relation to catheter associated. We know that people can get an infection, a urinary tract infection, almost any time. So how is healthcare associated infections as they relate to catheters and urinary tract infections?
Well, a Foley catheter is often what we call it, is inserted into your urethra to drain the urine from your bladder. And the best way to avoid a catheter-associated urinary tract infection is not to have a catheter. So if at all possible, insist that you don't need a catheter. If you don't need it, don't get it. If you do have a catheter, make sure that it comes out, is removed very soon. So even in some surgeries, they don't use catheters anymore. If you do have a catheter, you want to make sure that the catheter tubing is straight, that there's no coils, that the bag that the urine drains into is below your bladder. You want to make sure that those people who are trained to insert the catheter, that they are trained appropriately. And catheter-associated urinary tract infections, oftentimes we think, oh, it's just a urinary tract infection. Well, the risk is that the infection, so the bacteria that's in the urine, could seed into your bloodstream, causing sepsis. And that's a much more serious condition that can lead to death. So you want to make sure, and there's ways to treat sepsis as well, and we do manage that, but it is very critical. So my best advice for you is, if you don't need a catheter, don't use one, don't get it.
Okay, so I want to dive into sepsis just a little bit more, because you said that can be a very serious infection. If somebody thinks they may have sepsis, can you tell us what some of the symptoms are and how it is spread? You mentioned catheters, but is there other types of way it can be spread, and how would we know if we had that?
Well, usually sepsis is related to another infection, so in your body. So you might have pneumonia, you might have, you might have a different type of infection, and then it's that pathogen that's causing the infection seeds, so it gets into your bloodstream infection. It causes low blood pressure. It can cause organ damage. It's very serious. So usually you just don't get sepsis. It's related to some other infection. So my best advice would be, if you have an infection, don't ignore it. Talk to your healthcare provider. Get treated so that you can avoid sepsis. A lot of times it's called a medical trauma. We often see we think of gunshot wounds or car accidents as traumas. Well, sepsis is a medical trauma. So somebody who is septic will be lethargic, blood pressure will be low, and just getting to the hospital and getting treated is your best bet. But if you could treat the infection prior to it seeding the blood, then that's really your best bet.
Okay. We have about 30 seconds left. Can you tell us, if people want to learn more about hospital or healthcare-associated infections, where can they go to get information?
You can go to the Montana DPHHS. Sorry, that was my timer. Montana DPHHS HAI website. You can check with Mountain Pacific Quality Health. You can check the apic.org. There's lots of information about infections and how to prevent them.
Okay. Thanks so much, Pam, for the great information. And thank you for tuning in. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.